Hey, I have a special friend with me today, Jim Smith. Jim's been a dear friend for years. I think we go back 10 years, roughly.
10 years, yeah.
Jim's a DO, but he specializes in natural approaches of health, and there's lots of things he does. Give us a brief menu of the things you do up there at Jim's.
Dr. Jim's Center for Advanced Medicine. We're in the Westchester area.
Okay, real close.
In the new area of Westchester, I guess you call it. Yeah, not the old Westchester. And well, we just approach things from a natural perspective. We do a lot of colon cleansing. We do some energy work, evaluation energy work. Chelation IV therapies. We have like 81 different IVs that we have available for people. We really try to look at things first and foremost from a natural perspective.
Back up on that one.
Sure, go ahead.
Okay, because
sure.
I think chelation therapy is still new to a lot of people.
Sure.
Okay, even though it's not new. How long's it been around?
50 years.
You've been doing it for
10, yeah.
at least, ever since I've known you. What does that treat?
Well, there's a big change coming. Instead of calling myself a chelationist, I call myself a clinical metal toxicologist. I'm board certified. The heavy metals are becoming the thing now. There's a lot of mainline research. I think in the next 10 years, you're going to see huge talks about lead in children, which we've already talked about, mercury, autism, mercury, Alzheimer's. So heavy metals are coming into the forefront. We were just 50 years ahead of the curve.
Outstanding.
Yeah.
And you mentioned you do colonics as well?
Do colonics for colon cleansing, for GI health, sure.
Okay.
Yeah.
And what does that entail?
Colonics is, there's a small tube inserted in the rectum, and then it's a colon, it's similar to an enema, but because of the apparatus that we use, there's a higher reach. It completely cleans out the colon. Okay. The reason is, 50% of Americans have GI problems. I've been working in GI health for a long time. I've been interested in enzymes for a long time, and 50% of Americans have GI problems, and even you, I know people come in, they've got gas, they've got bloating, they've got constipation, their bowels aren't moving, or they've got irritable bowel, they've got diarrhea, constipation, or they may have some named disease, like I have stomach, I have GERD, gastroesophageal reflux, where the stomach acid is refluxing up. So, colon cleansing is just a good way to sort of retrain your colon and get it working. We have people who come in we have some people have a bowel movement once every 2 weeks. And, the colon is the toxic center. It's the garbage dump in your body. You've got to keep that thing cleaned out. And I just know that when I have bowel movements on a regular basis, I feel better. If I get a little bit plugged up for some reason, maybe ate too much cheese or too much dairy, I don't feel good. And so we really promote 1 or 2 bowel movements a day is healthy. And getting that colon cleaned out is really important.
I don't think people realize how our health is centered around our intestinal tract. Inflammatory disorders?
Absolutely.
How does that work? How does that affect? How does our diet and our intestines tie in with chronic inflammatory disorders?
Sure. You have things like ulcerative colitis, you have Crohn's disease. These are all diseases of inflammation in the GI tract. A lot of times what happens, and one of the underlying causes can be yeast or candida. Because of our diets today, so much processed food, so much sugar, we can get like a candida overgrowth. Candida is a yeast and it takes over your body. We're familiar with children getting a thrush infection in their mouth. We're familiar with women having a vaginal yeast infection. But the problem is it can happen throughout our body. When people...
And can that then affect our joints and cause our joints to ache?
Everything.
And then get maybe misdiagnosis, I have arthritis.
Absolutely.
And then before you know it, they get on perhaps medication for the arthritis, and are told to slow. If it hurts when you do it, don't do it.
Don't do it. And another big one for that, when you're talking about inflammation, the big catchword in medicine, that's astute on your part, is inflammation. That's the catchword today. What things cause inflammation? And another thing that causes inflammation big time when you talk about joints is food allergies. And we just do food allergy testing. People get off the foods. I just had a lady come in 2 days ago, and she said, man, I got off of those foods that I was allergic to. I feel better than I felt in years. And this was only like in 10 days. She lost 5 pounds within a month. I mean, she says, I have more energy, I just feel better. And the aches and pains are gone. And what happens, why we get food allergies, it's a little complicated, but the bottom line is that we have a tendency to get allergic to the foods that we eat. That's why it's so important to rotate your diet. Don't have oatmeal every morning for breakfast. Don't have eggs every morning for breakfast. Rotate your diet. because your body, you'll have a tendency to form allergies to those foods. And it's something that initially was good. I mean, oatmeal is a good food,
Yeah.
but it's not good to eat anything all the time.
And a lot of times the things that we're allergic to, we crave.
Absolutely.
Yeah,
That's the second end of that, right?
Yeah.
It's like, oh, I love peanut butter. Well, that's why you're allergic to it, because you crave it all the time and
Yeah.
you're eating it every day.
Hey, are there some common allergens out there that you could maybe get people to recognize or look toward? If I would say, name 5 of the most common things that people develop allergies toward, what would you say from your experience?
Milk, soy, wheat, and eggs,
Yeah.
and
Eggs.
peanuts. I would say those are 5 important ones.
What kind of other symptoms should people look for after they ingest this? Do they develop any other responses that they could possibly catch and then think, well, maybe I need to go see somebody like Dr. Jim or someone else who's can do an allergy test?
This is a, I'm trying to be a little bit humorous here, but if you're going to your doctor and you have problems, aches, pains, mental problems, mood disorders, stuff like that, you go to your doctor and he looks into things. And I just had a guy in yesterday, he was scoped this way, he was scoped, every way. He spent, I don't know how much money trying to get evaluated in conventional medicine. If you get to a point that your doctor says, I just don't find anything wrong, I think you need to be on an antidepressant, that's probably the time to come and see us, because, or before, because what happens in conventional medicine, when they come to a point they don't know what to do, they say, well, it must be in your head, let's put you on an antidepressant. We get so many people that come into us in that type of situation. And, it's so simple. I mean, the one gentleman I had yesterday, we did a GI workup, we did food allergies, and he's come back after a month now. His adrenals were burnt out. And, we're working with him. He said, God, I feel great. It just feels good. I mean, it's simple. It's so simple that, sometimes they can't get the concept.
How about respiratory? If they drink or ingest something, and then immediately after doing that, do sometimes patients manifest a rash or breathing?
Breathing hard, maybe a rapid heartbeat.
Okay.
They say, because your white blood cell count can start to go up. I mean, right away in your stomach recognizes it, maybe as a minor problem. The thing is as the symptoms are also subtle. Okay. You might have a mood change, you might get irritable, you may have problems, a little bit of problems breathing. I mean, it's not like a full-blown allergic response.
Yeah.
It's more of a sensitivity to that food. And all you have to do is rotate them out of your diet. The thing you can do it for yourself without even seeing anybody is you can just sort of take the foods and start rotating your foods, or try to be cognizant if something causes problems. Like, say you're drinking milk all the time, and after you drink milk, maybe you have stomach problems, maybe your mood changes. Well, rotate milk out of your diet and just see if it gets better.
Great
so
idea.
you can rotate things out, and if you avoid those things, like we said, milk, wheat, eggs, soy, and possibly maybe peanuts or peanut butter, pull a few of the most recognized ones out of your body and just see how you do with it.
Okay.
Yeah.